Question number 421. A child in the post-ictal stage of the seizure and should show which of the following sign and symptom? Option A, feeling sleepy. Option B, stiffness over entire body. Option C, verbalizes having an aura. And option D, eyes fixed in one position. So option A, feeling sleepy is correct answer. Question number 422. A patient has hepatitis B and is now a chronic carrier. So in planning, the nurse would explain an HBV carrier and would most likely be at risk of developing the super infection. So with which type of hepatitis? Option A, option B C, option C E, and option D D. So option D hepatitis is correct answer. Question number 423. An elderly patient with severe degenerative joint disease comes to the clinic for routine follow-up of pain management. So the patient reports that over the past month, the pain has begun to increase in severity and the patient requests an increase in doses of pain medication. So nurse recognized that this is most likely due to option A, drug addiction, option B, drug tolerance, option C, an improvement in condition, and option D, lack of efficacy of current medication. So option B, drug tolerance is correct answer. Question number 424. A patient with measles is an airborne precaution. So which of the following precaution technique would be essential to implement for the non-immune person entering the room? So option A, gloves, option B, gown, option C, a face shield, and option D, mask. So option D, mask is correct answer. Question number 425. A 5-year-old patient who underwent abdominal surgery suffer from deficient fluid volume related to NPO status. So intravenous fluid therapy is given for hydration. So which of the following indicate that the treatment is effective? So option A, urinary output of 15 ml per hour. Option B, respiration rate 35. Option C, heart rate is 100, and option D, good skin turgor. So option D, good skin turgor, it will indicate the good level of hydration. Question number 426. A 7-year-old child is brought to the physician office due to the sudden onset of bright redness on the cheeks, and the nurse observed that the child has a temperature with chills. So the nurse suspects that the most likely diagnosis would be option A, fifth disease, option B, rotavirus, option C, meningitis, and option D, hydrocephalus. So option A, fifth disease is correct answer because these all are the sign and symptoms of fifth disease. Question number 427. While caring for a child with ineffective airway clearance related to increased mucus production, so the nurse should encourage fluid to option A, maintain nutrition, option B, prevent boredom, option C, stimulate coughing, and option D, thin secretion. So option D, thin secretion is correct answer. Question number 428. Which of the following type of healthcare services is an example of primary level of care? So option A, diagnosis, option B, acute care, option C, restoration, and option D, immunization. So option D, immunization is an example of primary level of care. Question number 429. A community health nurse is administering the tuberculin skin test with purified protein derivative. So which of the following time frame should the nurse tell the patient to return to clinic for the test to be read? So option A, in 12 to 24 hours. Option B, in 24 to 36 hours. Option C, in 36 to 48 hours, and option D, in 48 to 72 hours. So option D, 48 to 72 hours is correct answer. Question number 430. A child is treated for superficial first degree thermal burn to the thigh, and the child is in the great discomfort and doesn't eat. So which of the following diagnoses should receive priority? Option A, altered nutrition, option B, impaired skin integrity, option C, risk of infection, and option D, acute pain. So option D, acute pain is correct answer. Question number 431. A nurse administers an albuterol nebulizer on a child with asthma. So which of the following indicate effectiveness of the treatment? So option A, adventitious breath sound with cough, option B, oxygen saturation 94%, option C, nasal flaring, and option D, respiration rate. So option D, respiration rate is correct answer. Question number 432. A patient finds that a 2-week-old infant unresponsive and the infant is limp, cyanotic, and pale. So there is no respiration while the skin is cold to touch, and the parents begin resuscitation and the infant is transferred to hospital where the infant expires. So most likely diagnosis is option A, sudden infant death syndrome, option B, apparent life-threatening event, and option C, apnea of infancy, And option D, respiratory distress syndrome. So option A, sudden infant death syndrome is correct answer. Question number 433. A 6-year-old patient has presented to the clinic with the fever, malaise and anorexia, and the patient was treated 2 weeks ago for the streptococcal infection of the throat. So the nurse should expect the physician to order which one test. So option A, electrocardiogram, option B, Jones criteria, option C, spinal tap, and option D, heart biopsy, because these all are the sign and symptom of rheumatic heart disease. Even after streptococcal throat infection, the patient could be the risk of rheumatic heart disease. So electrocardiogram is correct answer. Question number 434. The nurse is assessing a patient with a history of seizure disorder, and while checking the patient vital signs, the nurse even patient develop the rhythmic jerking movement of the arms and legs, and the nurse should immediately place the patient in which of the following position? Option A, prone, option B, supine, and option C, semi-follower, and option D, lateral. So option D, lateral is correct answer. Question number 435. A patient receiving the chemotherapy develop some raised and red erythematous wheal on the skin. So which of the following care plan alternative most likely need to occur before the treatment? So option A, reinforce the relaxation technique, option B, continue the chemotherapy without change, and option C, continue with radiation therapy only, and option D, pre-medicate the patient with an antihistamine. So these are the signs of allergic reaction. So definitely option D, pre-medication the patient with an antihistamine is correct answer. Question number 436. A nurse is assessing to care for a child with seizure disorder. So nurse observed the child become stiff and lose consciousness following by the jerking movement for 1 minute, after which the child become very sleepy. So which of the following type of seizure occurred here? So option A, absence, option B, generalized, option C, partial psychomotor temporal lobe, and option D, status epilepticus. So option B, generalized tonic-clonic phase is correct answer. Question number 437. While evaluating the nutritional intake of bedridden patient with a multiple pressure source, so the nurse should make sure the patient increases the intake of which of the following? Option A, protein rich food, option B, water, option C, food rich in vitamin A, and option D, a fiber rich food. So option A, protein rich food is correct answer, because protein rich food further prevent the patient from multiple pressure source. Question number 438. Prior to initiating the therapy with an unfractionated heparin for a patient who hospitalized, so with a deep vein thrombosis, so the nurse should plan to: option A, wait the patient, option B, administer aspirin, option C, limit the fluid intake, and option D, undress the patient. So option B, administer the aspirin is correct answer. Question number 439. A hospitalized patient has fallen from bed, and the nurse notes the shortening of the left leg and pain upon movement of the left leg. So, and rapid and shallow respiration also there. So what action should the nurse take first? So option A, call for help, option B, immobilize the left leg, option C, obtain the blood pressure, and option D, evaluate the lung sound. So these all are the sign indicate the presence of fracture. So definitely firstly we need to immobilize the left leg. So option B is correct answer. Question number 440. A patient has an order for pneumatic compression device. So which of the following is an appropriate goal? So option A, reduce the risk of deep vein thrombosis. Option B, reduce the lower extremity edema. Option C, reduce the lower extremity pain, and option D, reduce the risk of phlebitis. So option A, reduce the risk of deep vein thrombosis is correct answer. Thank you.